So this is a little interview for CHWs, community health workers. And today we're going to talk a bit about community health workers' role within a dental oral health setting. And I have Cindy and Cheryl here, and I'm going to let them introduce themselves. And then I'm going to ask a couple of questions. So Cindy, go ahead and introduce yourself first.
My name is Cindy Fisher. I am a community health worker for Capital Dental Care. My primary area of service is rural, Lane County. So I'm working in the rural communities. I also live in the rural communities, so I really have a feel for what's there. I've been living in communities for 40 years. I have a 20-acre farm. And so I really understand or try to work with the idea of living in the community. I'm also a coordinator for the Tiny House Project, which was started a lot of this community health work. And we have that. It's a little dental clinic that's designed like a tiny house.
Oh,
that
wow.
is going to be parked for the winter at one of the rural high schools where we have a partner medical clinic that we can provide prevention services to the community there, and they're so excited to get that. So,
wow.
I've been with Capital Dental for about a year and a half, and my previous experiences, I've worked for the government agencies in county with behavioral health and was an oral health program manager for 2 counties in Oregon. So, I'm very excited to be here, and I love serving people, and it's great to help them out.
So Cindy, and I didn't catch your title. Tell me your official title again.
So my official title, I'm a community health worker by a certified community health worker. I'm also in the dental field. I'm an expanded functions dental assistant. So I was certified at one time. I'm one of the few that has dental assisting experience, formal training. And then my title for Capital is the Tiny House Dental Coordinator for rural Lane County. So I work with rural coalitions, advisory councils, and other community groups to help promote and advocate for dental services in the rural areas.
Nice. All right. This is great. Great intro. And that's great that you have those different cross-training certifications. I think that's awesome, and something I see that we can expand upon in our U.S. healthcare system, that you don't have to be in one box, right? You could be in multiple boxes. I love that. Cheryl, same kind of thing. Give me a little intro on who you are, your title, and like a little background.
All right. So my name's Cheryl. I'm a community health worker with Capital Dental as well. My area is Marion Polk counties. I started with the company 8 years ago as a front desk receptionist. Then I moved up to practice manager.
Nice.
And in April, I moved over to the community health worker role. Got my certificate at OSU. I have lived experiences. I'm 16 years in recovery and 16 years from being houseless. So my passion and where I am in this role is with recovery, and people are in recovery, not ready for recovery, and the underserved is the people that or the patients that I help. We have a new dental van, so we do take our dental van to several different places. I'm on that at Bridgeway Recovery Services. We go to Great Circle. So yeah, that's my background. I live here in Polk County. I've lived in Oregon for almost 16 years, and my passion is helping people. And this is not a job to me. This is something that I love to do, and I love to advocate, help patients get their smile back and know that they matter, and that there's no judgment at all.
Oh, I'm so emotional today that I'm going to start. That touches my heart. I think that we in community health work, we care so deeply for people, and we're so passionate about what we do. So I'm so excited to have both of you here to really kind of talk about how we can get community health work in And you're kind of also talking about that peer support too,
Yeah.
about how we can really bring it into the healthcare system. And so let's talk about that, okay? Because like, this is I see this video being watched by community health workers and peer support specialists, and it's like, how do we get into the system, right?
Right.
So let's talk about your typical day. Now you're free to share slides, show me whatever you want. Cindy, I know you have some slides to share. Cheryl, whoever wants to take a stab at that. What is a typical day for CHW in a dental healthcare setting, right? Because this is not a typical thing.
Right. Right.
So who wants to take a stab at that one first? Cindy
Well, I'll
or
let
Cheryl?
It doesn't
Daryl
matter.
go first.
Okay, I'll go.
Cheryl, go first. You go first. All right.
Okay, so my typical day is different every day.
Every day.
So we have an internal community health worker referral form that we will get from offices if they have a patient that, or even from the admin center, the Capital Dental Admin Center. Maybe a patient can't read or write. Maybe they have high anxiety. Their fear of dentists is grand. We'll get those referrals in, and we will contact patient and chat with them, meet with them beforehand if needed, or just talk a few times, meet with them in clinic on the day of their appointment, help them with their paperwork, just really sit and talk with them, kind of maybe breathing techniques, anything that might work for them. We're doing in clinic. We go with them to the back, and we're the support system in the back with them as well. I'll go over some stories a little bit later, patients that we have, but we'll just go over the day by day right now. Other days, I could be not in clinic. I could be at Arches, maybe at a pop-up tent with a EPDH, an expanded practice hygienist, doing screenings of fluoride. At that point, if they're, they need to have a cleaning done or they're in pain, then right away I have my computer with me and I can get them into a clinic either same day or next day for emergency visit. Or Bridgeway has offered to see patients that I see on a daily basis, and they'll let them see it on our dental van. So I'll refer them over there to get cleanings.
I have a question.
Yeah.
So one of the big things that, everyone's got like a space in the healthcare system to kind of enter, the medical assistant comes in, takes your history, or the dental, just, where does this, a CHW, or let's say a peer support specialist, where does a traditional health worker like fit into that day? Like, when they check in, do they have like a screening? I mean, how do you fit in like to that? Like, is there a process?
Well, kind of. I mean, we Cindy and I have a screening form that we use when we meet with them as an SDOH screening form and a dental, what would you call it, Cindy? A dental anxiety screening
assessment
that we do with them.
And is that screening form, does it have like, do you have have trouble getting food, or are you struggling with housing? Kind of like asking some probing questions around social determinants of health to kind of see where they're at.
Right.
Is that kind of?
Yeah.
Okay,
right.
Cool.
Yes.
All right.
So yes, we do those as well. Like I said, I'm at several different places, maybe on the same day. So I could be in one clinic in Salem, and then in the afternoon be at a clinic in Woodburn. I'm also doing a street outreach with Recovery Outreach Community Center. I go with them at least once a week or every 2 weeks to the camps, and we hand out hygiene kits, and we talk about what ROC has to offer and what I have to offer in oral health.
So you're doing outreach.
Yeah. Outreach as well. And like I said, we do pop-up tents. I'm with hygienists. I assist the hygienist at Bridgeway. After, we bring the patient in, we do the SDOH and the dental assessment. Then we take blood pressure, we get them ready, we warm hand them off to the hygienist.
Oh, I see it.
We do the perio charting with them, And then we do the cleaning with the hygienist, and then I get them scheduled into the clinic afterwards.
So you're working alongside with the hygienist.
Correct.
Mhm.
Correct.
I could totally see it. So like I'm coming in, by the way, I want to fess up here. I have a little bit of dental anxiety. And because I associate my teeth, I have bad teeth, like hundreds of cavities, like every time I go, and it's painful for me. So you would be, I'm like your anxiety patient. I'm sitting there. You say, "Hi, Sarah, how are you doing today?" And then you walk me back and you give me a little screen just to check in on how I am as a person.
Right.
And then you walk me back and you say,
Right.
"Hey, here's your hygienist.
Yes.
We'll be working together today."
Yes.
I see it.
Yes.
I need you too,
We can
because
be there. Just call us.
yeah, because I think sometimes it's like it feels like when you go into a dental office, you're getting kind of put into this machine,
Yeah.
and it's like they take your blood pressure, and it's like,
Right.
and if you got anything going else on in your life, it becomes like you want me to do all this with my teeth.
Yeah.
And I'm just struggling to even get here today.
Mhm.
Right. And I'm hungry, or
Yeah.
I'm worried about my house.
Right.
And you want me to take care of this?
Exactly.
I hear you. All right. That makes total sense.
And what's great is when we're in like the recovery centers, it's outside of the dental office. It's someplace that they're already familiar with.
Okay.
That's a really good thing. And so when we're there, we're able to connect with them in a different way than them walking into the dental office. They're walking into either our van. Before our van was ready, we were in a room inside Bridgeway. So we were able to connect in that way and talk more and build trust and have that get to know each other before we go step foot into a dental clinic. So that kind of, I think, makes it a little better because we already know each other. We've already talked. We've already connected. We've maybe even talked on the phone a few times before their dental appointment. So when we step into the dental clinic, they're familiar with me and I'm familiar with them.
Got it.
I think that helps ease the nerves. I have 3 or 4 people right now that I'm helping with anxiety, and every time after we're done with an appointment, I get either a text or a voicemail saying how appreciative they were that I was there to help support them, and that they felt cared about and they felt supported and they appreciate it. And it makes that appointment so much easier for them.
Right.
Yeah.
Because when they're coming in to do the dental work, and even checking the pain level.
Yeah.
And being able to communicate to say, "I'm in pain." Yeah.
I do have a story about a gentleman. I mean, I can tell the story now, or we can wait until you're ready, but I do have a story about a gentleman that I just helped on Tuesday.
Now, I say you do this story because we're like in this kind of space. So go for it. Tell me your story.
So this gentleman had a scheduled appointment in September that he missed, and he didn't realize he missed this appointment. So when he called to find out when his appointment was, he called in October. He was quite upset to know that he missed the appointment. So he called the call center here. That's where my office is right now, is the call center. And he was really upset about this. So he has self-proclaimed anger problems. He tells me this. I have anger problems. So he did get a little angry with some of the call center people. And then he was switched over to the director. So she was able to calm him a little bit, but she came to me and said, "Hey, I have a patient for you." So I called him. I called the office where he missed the appointment to see when I can get him scheduled again before I called him. And it was not till January.
Oh,
yeah. So I said, let's see what we can do. So I called him and I explained to him that, they do have an appointment, but it's not till January. And he's like, "You don't understand. I'm in pain. I need to get these teeth out. And then I have dentures." So he's been for full mouth extractions and for dentures. And I said, "Okay, let me call around the sister offices and see what I can do."
Wow.
So I called, and the office here in Salem was able to get him in that very next week on Tuesday. So that was this last Tuesday.
Nice.
And so we talked about what this appointment might look like. how he's feeling about it, and, and then got him scheduled. So he had to be there at 6:45 in the morning. So I said, okay, I'll be there with you.
Wow.
And he texts me back a little bit later and says, I can't get a ride. My mentor cannot get me there that early. And I said, it's okay. Let me call transportation and I'll get it set up for you. So I called Motive Care, got him set up on transportation, and I met him at the clinic at 6:45. And so we just sat down, we did all his paperwork, we started chatting. He's telling me about, his accidents that he had. He's told me about, how he feels about Dennis. We talked about just life in general for like a half hour before they called him back. But before we went back, he had told me that he has hearing aids and he wanted to know if he could hook his phone up to his hearing aid so he could listen to music, because this is a 2-hour-long appointment.
Yeah.
Get the extractions. And I said, absolutely, but we need to make sure that you can hear the doctor as well. So him and I came up with some signs. So when I was back in the room with him, I could understand what he was trying to tell me when he had his mouth wide open. So this meant turn my music down, turn my music up, pause music, or play music. I'm doing really good. Or please, I need to stop for a minute.
Oh,
And so we went back and he sat down and I went and talked to the doctor and I let her know that, hey, I just want to let you know he has anxiety, does have a little bit of anger issues. He's told me that I told him, if you're feeling that way, let me know. We can talk about it and then I can relay it to whoever you need. And then that way we can kind of keep it to a minimum. And she said, really appreciate that. We get in, we start all the treatment. 2 hours goes by, his ride shows up. He's still not done. So they have to come back in an hour. Yeah. So, and I don't know if you're familiar with rideshare or Motive Care.
Yeah.
Sometimes, it can be a little bit of a wait.
Mhm.
During the appointment, we did all the hand signals. Everything went great. He was the perfect patient. We got done at 10. His ride showed up. We were doing post-op instructions. And when we got back outside, the ride had left already.
Uh-oh.
Yes. So I called Motive Care and they said 40-minute wait.
Ooh,
And I said, oh, listen, he just got done with surgery. We really,
he's exhausted. Yeah.
a long surgery, 3 hours. And so they said, well, I'm really sorry. It's 40 minutes. I said, please see what you can do. And I told him, and of course he was a little upset, but I said, let's just go back inside and hang out for a bit. 10 minutes later, we had a driver there, which was great. So they got there at 10 minutes. He left and went home, and he texted me later in the evening and told me how much it meant to him to have me there to support him, because he didn't feel like he had any support anywhere else, and that, how appreciative he was. And then so the next day I called to check on him, and he had told me that he was having some chills and nauseous, and I kind of gave him some ideas, and I said, it's a big procedure. And I said, but let me call the doctor and tell the doctor what you're feeling. So I called her, and she said what I told him was perfect, but just let him know, you'll feel better if you do these things.
Right.
And she said to me, she goes, Cheryl, I just want to let you know that I appreciate that you were there at that appointment, because I felt like that appointment went much better because I saw the patient in a different way, because you were there to help support that. I saw him differently than if I was just to walk in and just see this gentleman sitting here. So I think as a community health worker, not only are we benefiting our patients by being there for support for them when they don't feel like they have support anywhere else, but we're also there for the providers.
Yeah.
So they have a better understanding of what this patient has gone through in their life. They usually just walk in, go over health history, and, let's start the procedure.
Right. Because that's all they have time for. Right. That's
So,
how we've set it up. Right.
right. So it's nice that Cindy and I can be that support system for not only the patient, but for the doctor and the clinic as well. So it's not like, we're community health workers for patients, we're community health workers for for everything that's involved from step one to the end. So then after this point, we got him, he got settled, he's good, he was good yesterday. We got him scheduled for his insurer's impressions in 3 weeks, and I'll follow him on the journey. He's asked me to be with him at all his appointments. So that I feel like it was very heartwarming to me. I mean, I know he got support out of it and he got the things out of it, but I got out of it too. I felt like this is something big, and this feels good to be able to bridge that gap, because would that patient have got scheduled sooner? Would that patient have not had an outburst had he not had the support that a CHW can?
Mm-hmm. And it shows you how, if we integrate the system and actually put a role for the community health workers and the peer support specialists, it's like it also is a tool that the providers can tap into, so they can focus in on the treatment and work conjunction with the traditional health worker.
Right.
So that is a beautiful story.
Yeah.
Thank you for sharing that, because that, I think, leads into Cindy telling us a little bit about the structure of all this. And if you have PowerPoint slides you want to share, however you want to take it from here, Cindy, because this kind of warms up to that, like, what does this look like? Cindy, this is a perfect segue to really talk about how that looks. How does a community health worker integrate into a healthcare dental health setting specifically? So Cindy, take it from here.
Okay, so each one of the community health workers that are employed by Capital Dental Care have sort of a specialty role as well. So Cheryl talked about working as a program manager or a clinic manager. We have new community health workers who are receiving their formal training right now to get certified, and they all have their areas of where they wish to serve or expertise. Cheryl, as well as another certified community health worker, are working with some of the recovery centers. They really have a passion for serving the people that are going through recovery. So we're teaming them up with a hygienist that works there. We have someone who's interested in working with the IDD, or disability, persons with disabilities work groups, and really wants to devote time to really outreaching and advocating for that group to get dental services. I mentioned before that I'm an expanded function dental assistant, but that doesn't mean that anyone that's a community health worker can't do the assisting. So we are able to train our community health workers to assist with a hygienist. It's not as stressful as being an assistant with a dentist. We wouldn't want to do that because it's a more technical type of assisting, but we really are able to get that as a team member. So the idea is that the community health worker can enhance those services that the person is receiving by being that constant source of support. And then what happens is they're also a team member that allows the other providers to work at their highest level of licensure.
Right.
So we are able to allow community health workers to do things that they do not have to be certified or licensed to do. So something as simple as taking the blood pressure, or providing the assessment up front and starting what we call the conversation. Really trying to figure out what are the needs of the person, not what do I think you need to have, but how can I support what is most important to you? And I think that's where we have to give up some of our own biases and internal beliefs sometimes. I know that I did a assessment with the patient, and she was homeless, but her blood pressure was extremely high, that she really needed to see a doctor. But my suggestion was, we need to get you to a doctor. She goes, but I need a job so I can get money to get a house, to find rent. So anything I would say about her overall health was dismissed by her current need. So it have to be really aware. And I think the community health worker brings some listening skills that are, I wouldn't say ignored by providers, but sometimes providers are very focused in what they're trying to do. And when a patient may say, this hurts, or it doesn't feel good, we're so used to going ahead and just doing our work that the community health worker can say, we need to take a minute for a breath. I think it's really important to be respectful and have a trauma-focused environment in which this person comes into.
Mhm.
Um,
And you said trauma focused, which I really like, because I might be triggering on something in that chair
Yeah,
that the provider might not be catching, as he's doing, because they're focused in on my teeth, which I really want them to be focused in on, but they're not watching me grab like this or starting to hyperventilate. And that community health worker could be like,
wait a minute.
wait a minute. Yeah.
And that's probably where a lot of the assistant skills come in from that, because we learn to actually watch respiration. We talk to a person. I've had a couple where they're so touch sensitive to the inside of their mouth. I went out to help someone to do some practice sessions. So the dentist is not in the building, but the office has fewer providers or hygienists in the office. So I met with this person to be able to sit in the chair. Practice sessions is what I call them. They're not billable sessions by any means, but they're ways to get someone familiar with what's going on. And the first time I met one of the clients, I went out to get her and I said, are you ready? And she goes, yes. And then she started sobbing. She started
Aw.
sobbing before we even walked through the door to the dental room. And just working with, like Cheryl talks about, working with breathing and visual techniques to help with calming the person down. And after a couple sessions, things are better. And then I said I would be able to join her for her appointments. And again, she started crying. And she says, no one ever listened to me. And
Aw.
so her thing is she was very sensitive to touch to her mouth.
Mhm.
And she felt that, even though she knew she needed to have dental work done, it was so scary for her to be in the chair with someone that had gloves, that was close to her face. It's very intimate. And so how can we be that person that says, okay, let's think of our visualization right now and breathe. And so working with a hygienist this last week, and she was providing anesthetic. So, getting this shot, and you could tell that the person was high anxiety. He didn't really say it up front, but he was clenching his fists and his breathing, he started to hyperventilate. And so then we just start into what I call almost like CPR breathing. It's just like, breathe, 1, 2, 3, out, 2, 3. And then I would tap his shoulder when we were going out, and then, breathe in, and then counting and breathing out. And so allowing the patient to listen to a voice, saying to them, look, if you can open your eyes, look at the hygienist, or look at something, because when you close your eyes, your senses just get so heightened. And so one of the things is people need to open their eyes, and that's a lot of times they don't think about that.
Yeah, you remind me that I remember once someone said, because I was struggling with something, and they said, lift up your toes, like flex your toes back. And immediately that response went back. But the thing is, you both mentioned something, is that you're giving people tools and skills that they can use for the rest of their life. But no, and you're doing something else that I think is really important, is that you're giving space for someone to even share that they're having that reaction, and you're not judging, because I really appreciate that, because I feel like sometimes when we're in a treatment process, it's kind of like the doctor they're on a timeline, and I'll be frank, embarrassed by my anxiety or my emotional response. And that's a normal, but you both say, oh no, that's okay. Yeah, let's,
Mhm.
yeah, it's a normal response, right? Like, here,
Yeah.
let's give you some tools.
The other little tool that I use is when we take x-rays. Our sensors are digital, and so they're
Oh.
bigger. And so it's really hard to get everything in the mouth. And so one of
Yeah.
the things that I do is a lot of people have small jaws. And so
Yeah.
this comes from my assistant experience with taking x-rays. And so it's a mind trick, and it helps. And sort of the hygienist has to be willing to try it, but it's worked several times. And it's a process, so it takes a little bit of time. So someone who has gagging issues, or someone that, we can't get the sensor in, I said, we need to lay this on your tongue. And so we have to do a little exercise first to figure this out. So when you breathe, you breathe in, your tongue comes in, you breathe out, your tongue goes out, usually in a
Mhm.
relaxed state of mind. So the idea is that you have to trick the mind so that the mind and the body are not really working together, but they are. So when I work with patients, I say, I want you to breathe in and stick your tongue out. I want you to breathe out and pull your tongue in. Okay, let's try it again. Breathe out, or breathe in, and your tongue goes out. Breathe out and your tongue goes in. Now, when that goes in, I would place the sensor on top of the tongue, and it's amazing how many people are relaxed, their jaws relax, and it just goes right in.
Wow.
So it's just some of the things, the little tricks you learn along the way. Anyway, that's it. It works really good. People like it. They don't fight it.
And I think that, this whole interview was just kind of like really showing people how the CHW can fit in. And what I heard you say that I think was really interesting is that they can fit into a lot of different places based on their lived experience. So they might connect with outreach events. They might connect with the teeny house. They might help with the screenings, and work along the hygienist. But there are a lot of different ways that they can do this. And I'm also hearing cross training.
Mhm. Very much so.
Okay. So I guess I'd like to end this interview with, and I'm going to stop this unless you have another slide to show. Do you have any other slides?
No, the only thing I can say is that there's one of the slides, and it's the next one. It talks about the modality model that we work with, and it's really the dental home is what we provide. It's the integrated expanded practice dental hygienist dental home. And what we are doing is we are making patients dentist ready from the field. And so our job is to be able to provide prevention services up front, which includes x-rays and intraoral pictures and charting and cleaning. And I would say in a non-threatening environment, our environments are so much more different than in your typical bricks and mortar building. And that we can provide support to these members before, in between, and after appointments that keep that tie going. But the model is really this providing a dental home that is not truly your dentist home. Is that you can come for prevention care after you get all your dentist care taken care of, and we can take care of you and help you along the way. And we can help you, and we can partner with a peer support specialist. That is ideal because a lot of these people have other behavioral or mental health issues that would be better served in a behavioral health setting. And so when we can partner with those peer support specialists, the family support partner, the peer support partner, youth support partners, then that really creates this wraparound service that we have, the system that can really wrap around and help this person be holistically healthy as well as orally healthy. And that's what I really want to say there.
And I'm glad that you said this because I want to share this interview with peer support specialists too. And so we have the CHW really working this way, but also referring out to other supports too. And And so, really getting them connected to services and to support systems, not just in the dentist office, but that whole community approach. All right, that is great. So now I want to stop the share for a second, and I want to ask this question, kind of ending it. Where, because you've really talked about the things that give you joy. I'm sure there are challenges. What tips would you say for a CHW or a peer, let's say, who's connecting? What tips would you say to someone who's in the field already or is considering going into the field that you would advise them becoming a CHW? Just like pro tip. What's important for you to do your work? What do you think is really important?
You want to go? I
I
would say self-care.
think,
I would say self-care is probably the number one priority. And the reason that you have self-care as number one is that you can't do your job if you're feeling totally overwhelmed, totally under the gun. You have a full load of patients and you're not getting enough sleep. You're feeling stressed. So I
Okay.
think that, and then having a small support team. Cheryl and I are the first ones to have these titles with Capital Care and Dental Care. And I think having a partner that you can actually talk to, having that sounding, not really a sounding board, but someone to run other things by. We have supervisors and we have other leaders in our company that are really good resources for us, but it's really having that other person that you can count on. So that if you're by yourself, it means looking at your community and who else can you find in your community that's a community health worker that can help with as mentoring or help with information that you might know of or might have a similar role. I just think self-care is one of the things that is important. And then when my other thing is it's really hard not to be so involved with these people that you just want to help them with everything. So it's knowing boundaries. And that's
I know you're going to say
probably
boundaries.
probably that's one of my hardest. Those are the two hardest things I have issue with. I don't know how to say no.
yeah.
And typically I put people first.
Yeah.
Everyone comes before me.
Yeah.
So how can I help people if I'm on the sinking boat myself? So I have to take care of me. And Cheryl's smiling. She understands. So I'm going to let her add anything else to it she needs to.
You took the words right out of my mouth, Cindy. Those were my top two as well. And I think you and I have had those conversations. That's probably
Yeah.
But yes, definitely self-care and definitely boundaries. I know when I am with a patient, because I do have a work cell phone, I let them know that, I don't answer the calls on the weekends, but if it's an emergency and something's going on that you're swollen or whatever, text me, because I will look at the text. And if I see that's an emergency, I will give you a call. And I try to say, 7 to 5 is when I answer my phones. But, if it's an emergency, I don't mind after hour text, so I can kind of really see if if it's an emergency or not. So, but self-care, huge, 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 huge. Cindy and I talk about it all the time, and boundaries. Yeah.
Self-care and boundaries. And it's very hard. I'm a very passionate person.
Gosh.
I'm very intense about things. I care. If you get to know me, and sometimes people say you shouldn't care so much, and so I think being with the other community health workers or being with other peer support specialists, you start to see, we care. And we want to be a part of this transformational system. And I bet you sometimes you might get a little frustrated because sometimes you might hit walls sometimes, not so much within Capital Dental, but in the system, right?
Yes.
Mm-hmm.
Do you ever get frustrated?
Mm-hmm.
Yes.
Capital Dental, but in general with life, couldn't we get this
we-
housing thing figured out?
I think my best when I'm running. So usually if I'm trying to figure something out, I'll go for a run because it kind of
Just clear out that stuff, right?
yes.
You know that thing, I have a mantra, focusing on the things that you can control and the things you can't, and know the difference between what you can control and what you cannot control. But and use your energy on the things, because we do have some things that we can make an impact on our life. And we are, as community health workers, we are helping change the US healthcare system. We might not see it happen all at once, but we are making steps. And this is example, Capital Dental is an example of a system change that's starting to happen. So I want to thank both of you for your time. And I want to tell you that I'm so excited about this interview that I'm going to share it with the world.